Welcome to Pharmacology lectures. Now we are going to study about signal transduction. Okay, signal amplification. This is the term where the enzyme linked and G protein linked. These two have the ability to amplify the signal intensity. Because activated G proteins, they will persist for a longer duration of action than does the original receptor complex, which means we'll take an example of albuterol. It will exist only for a few milliseconds, but due to the signal amplification, what it means that activated G proteins will last for hundreds of milliseconds. It means that this amplification, what will happen, only a fraction of total receptors will be needed to be occupied to give a maximal dose response. Now the opposite is desensitization, also known as down regulation of receptors. When we repeatedly give a dose, what happens, the receptors desensitize, which means too much agonist stimulation has done with the desensitization, which will ultimately result in diminished response. You have to give more dose to see the effective response. This phenomenon is known as tachyphylaxis. It is due to the phosphorylation that makes the receptors unresponsive towards the dose, towards the agonist. Receptors can also be down regulated, which means some receptors, especially ion channels, they require finite time following stimulation before they can be activated again. During this recovery phase, unresponsive receptors are said to be refractory. Now repeated exposure to an antagonist, okay, on the other hand, will result in upregulation, in which receptor reserves are inserted in the membrane, increasing the number of receptors, and this upregulation can make more sensitive towards the agonist next time. Now we can have a look at this. Now you can see we are giving a dose. By repeatedly giving the response which we used to have, maximal response we will not get again. This is known as diminished response of the cell, desensitization. When we'll give enough time for the cells to recover, then we'll get the same response on the same dose. This is the phenomenon of desensitization. Now dose response relationship. This is the agonist, they mimic the action of the endogenous ligand or the receptor, our real mechanisms. The magnitude of the drug effect depends on the receptor sensitivity. Graded dose response relationship. Now you have to understand this. Now we'll understand by the graph. You can see here the EC50 is effective concentration to get the 50% of the response. This is the maximum effect, 100%, and this is the drug concentration. Now this is 50%. Drug A, the 50% we have achieved here. Drug B, 50% we have achieved here. This is known as this is the concentration. It is known as effective concentration, 50 at 50% response you can get. Now these two terms are very important. They are often also asked in several questionnaires: potency and efficacy. What is a potency? It is a measure of the amount of drug that is necessary to produce an effect, and efficacy is the magnitude of the response of a drug that causes when it interacts with a receptor. Now potency is the amount of drug to produce an effect, okay, but efficacy is the magnitude of response. Now potency, the concentration of the drug producing 50% is EC50, which determines the potency. Now we have seen drug A and B. A is more potent because in less dose, less amount it produces the effect. Drug A is needed. Okay, now if efficacy is dependent on number of drug receptor complexes formed and the intrinsic activity of the drug, its ability to activate the receptor. Now Emax, maximum efficacy of a drug. Emax, when the drug occupies all the receptors, and now even if we increase the dose, we cannot see any increase in effect or response. That maximal response differs between full and partial agonist. You have to understand this. Even when the drug occupies 100% of the receptors, similarly, even though an antagonist occupies 100%, no receptor activation results in Emax is 0. Efficacy is a more clinically useful characteristic than potency, because the drug which has greater efficacy is therapeutically beneficial than the one which is more potent, because we need the drug to be more efficacious. You can see the graph and make more clear for your potency and efficacy concept. Now here you can see drug A, we are getting here, it's EC50, okay, 50%. Drug A is, it means it is more potent than drug B. Okay, both show same efficacy because they have same maximal effect, same maximal effects. Now drug C shows lower potency because it is delayed, it needs more amount of drug, and C, maximal effect is here, which is also lower, 50% is also lower, so it is low, it has lower efficacy and lower potency. These are the two terms you have to understand. Welcome to the pharmacology lectures. Here we are going to see three terms: full agonist, partial agonist, and inverse agonist. Now this is the drug concentration in the x-axis, and there you have receptor activity. Okay, drug concentration. Full agonist will produce complete activation. It will completely activate at higher drug concentrations. You see, at these concentrations it completely activate. Partial means it will partially activate. It should be less than 100%, less than the full agonist. Whereas inverse agonist, it will produce a response below the baseline, okay, in the absence of the drug. Now you can see here the consecutive activity without stimulation. You can see the concentration and receptor activity response. Now we have seen here full agonist. You can see this one, red rhombus. Partial agonist is blue. Full active receptor is when full agonist has been binded to the receptor, and partially active receptor is when the partial agonist has binded to its receptor. It will partially activate the receptor. When high levels of full agonists are activated, all the receptors will be activated, whereas when partial agonists are displaced, some of the agonists will result in diminished response curve. We can have a look at this graph. Fraction of the maximum response and against response provided by partial agonist. The red line shows the full agonist, black is the total response. This is provided by full agonist and this is provided by partial agonist. Higher concentration of partial agonist, the agonist is completely displaced and the receptor activity is determined by the intrinsic activity.